We're going to be looking at the neurological processes of placebos and how the placebo effect actually tricks our brains into alleviating pain. Placebos show us the importance of the interconnection between the brain and the body, but it's also important to note that positive thinking alone will not achieve the expected results of a placebo medication. There are countless of neurological reactions that factor into the effectiveness of placebos. The first component would be how our brains respond to the contextual information around us. There are two main types of context information: external context and internal context. External context includes verbal suggestions, i.e., phrases or words we use to convince ourselves of a specific outcome; place cues, understanding where we are situationally by what we can see; social cues, how we interact with social norms and other people, including eye contact, body language, etc. Treatment cues, understanding what kind of treatment we're going to receive by making inferences like a syringe involves an injection, and so on. And moving on to internal context, that includes outcome expectancies, which basically means having some notion of the level of pain we will experience in a specific procedure; emotions, how we feel about certain treatments or how we feel about our pain; explicit memory, and as well as precognitive associations. These both refer to what we already know and things that we've already experienced and how we will infer it to what we're seeing now. And our brains process all of this information in the prefrontal cortex, which is essentially the area where our thoughts, actions, and emotions are regulated and controlled. And our prefrontal cortex will then connect to neurochemical systems of our brain that include the pericaudal gray or the rostroventromedial medulla. Here, these regions will then transmit neurochemicals like oxytocin, dopamine, and serotonin and opioids to modulate pain and pain-related behavior. These neurotransmitters will then transmit pain signals to the spinal cord and can either decrease or increase the pain levels. In response to the placebo, these neurochemicals can either increase the pain levels or decrease them. This process can also function the other way around, where the pain signals from the spinal cord are transmitted back into the brain. Our brains will then use the context information around us to determine the pain intensity we will feel, and these can be manipulated by placebos. Overall, placebo effect influences various areas of our brain and can influence our neurological activity as well as our psychological associations, and controls how we respond and manage pain.